Hi, I'm George Perry, and we're going to continue on with our look at implants A to Z from a restorative perspective. This section 3 is a very important section. Here we look at how to work the case up, and that's not just a technical workup, but it's also how do we take the patient and make them want to have the treatment. You know, it's easy to say, well, you need to have this treatment, but it's hard to make the patient want it. And we need to do that from everything we do. Every person in the office needs to be thinking, how do we encourage the patient, how to reassure them, how to deal with the psychological issues that we have. And while we're doing that, we're being efficient, we're working the case up, we're talking about the advantages and the limitations of treatment in a way that makes the patient feel comfortable, even with the limitations that they might have. We look at patient education as really being a key in the three different phases we might look at, where we plant seeds. And in a restorative office, this could be in a hygiene room where the hygienist just talks to the patient about, you know, if they're wearing a partial denture, how can we improve life for them? How can we make them more comfortable? So that first meeting might be with me, where the patient comes in just for a quick, hi, how are you? This is what I can do for you. But I don't know what I can do for you, and this is how we go about it. We go about it really by determining candidacy. And so our goal, at least, is to get the patient interested in finding out if they're a candidate and what that might mean from a cost point of view, from a time point of view, even from a discomfort point of view. And that's one of the biggest limitations to treatment, is that patients are afraid of pain. So we try to focus the patient's expectations, their desires versus needs. We try to understand their psychological profile, and we move on with the patient to where we get to treatment presentation. Hopefully at this point the patient's involved in the treatment and they're ready to go. And for us, this is our point to give a firm recommendation, and the purpose of our whole course is to make you feel comfortable with giving that recommendation. It shouldn't be that the patient chooses 5 different treatments. You need to look them in the eye and say, this is what you need, and be confident about it. Mounted models, case workup, all these things lead us to giving the patient what they need. So working up the case, doing good surgical guides really might be the key. Now, when we do CT scans, I like to have a surgical guide with the radiographic markers placed. To do a CT scan without those, to me, is kind of a waste. We don't really, or not able to really translate the final restoration into the actual profile of bone that we have. So the next phase of treatment planning is being able to do a good surgical guide that can be translated into a radiographic stent, and then doing a good CT scan so we can really figure out what the patient needs and what we're able to do for them. We do 2 different kinds of guides. We do general position guides and a true drill guide. These are interesting, but it always requires us to understand what our limitations are as surgeons, if we're the surgeon, and being able to create a guide that will solve those purposes. We like to communicate to the surgeon, if we're working with a surgeon, exactly what we're trying to achieve. Is it screw retained? Is it cemented? Where do we want the emergence profile of the crown? And all of that can be done with a good surgical guide. A surgical guide can be simple, just a small little piece of acrylic with a particular guide to place that implant exactly where we want it to be to give the patient what they're hoping to achieve. So when we can really understand the patient, and we develop that during treatment planning, when we get the patient on board and part of the team, and then we can translate that into a surgical guide to exactly explain to the surgeon what we're trying to achieve, I think we get the results, the predictability, the outcome that we're hoping to have.
For more education programs, visit the Guide Institute at www.guidedental.com.